Hello, my name is Marc Hulsey. I've enjoyed watching the video lectures, and it's an enjoyment to be able to try to do one myself. So, I've also noticed that you're an Auburn fan, and I'd like to say War Eagle. Let's start off by looking at what is a disorder. A disorder is described as something that impairs daily life. The disorder I'm speaking about today is generalized anxiety disorder. A few things I'd like to talk about with generalized anxiety disorder are the characteristics, the prevalence of the theories for the cause, and this also will describe some of the statistics. Also, the prevailing treatments for this disorder. Well, for the characteristics, the DSM criteria for diagnosing generalized anxiety disorder show that there needs to be a strong avoidance and escape mechanism so that they're worrying that they cause themselves to want to avoid it. Another issue is clinically significant distress and impairment. Well, again, this goes back to the disorder, and if you are so impaired or distressed that you cause a disorder within your daily living. This is also that your worry is future oriented. You're thinking about the future and you're worried about it, but it's not also limited to just one thing. Another issue is with comorbidity. Comorbidity is where you have two disorders that are aligned with each other. With this disorder, it is shown a strong relationship with depression. A few things that it also states for the criteria are that you need at least 3 symptoms and that these symptoms need to occur for more than 6 months. These symptoms are restlessness, fatigue, difficulty concentrating, irritability, muscle tension, sleep, and a sleep disturbance. Muscle tension is an important one. We'll describe more when we talk about the treatments and the causes. But let's get into the statistics of this issue. A 1-year prevalence is shown to be at 3.1%, and that is meaning that within a 1-year time span, at least 3.1% of the populations are going to be diagnosed with general anxiety disorder. This also goes on to show that within a lifetime, that this is a 5.7%. Also, the prevalence within male to female, that it shows in the United States, it's a 2-to-1 ratio for female to male. This is not true in other cultures or in other countries, but for our situation, it's going to be a 2-to-1 ratio. This also shows that the onset is gradual. It is not acute. It doesn't just suddenly happen. This also is generally found in early adulthood. Another end of the spectrum is that it shows that there's a lot of prevalence in the elderly, at least 7% in the elderly. This again is a lifelong issue. It's not just a short bout. It's a chronic course. Next, we'd like to discuss some of the general anxiety disorder theories. The two theories I'd like to discuss are the biological and the cognitive behavioral. With the biological, it is shown that there is a generalized biological vulnerability. This does not mean that you are destined to have generalized anxiety disorder because your mother has it, or your father, or anything of that nature, but it's the way that your parents or the person that has a stress issue is how you're going to inherit how you handle with the stress. So you become more predisposed, but you don't necessarily have the general anxiety disorder. Also, the general anxiety disorder with biological theory of cause is that they are autonomic restrictors. This shows that when their physical symptoms, their heart rate, their blood pressure, they're about normal to everybody else. But the thing that really stands out as a physical symptom is the muscle tension. With this muscle tension, it is noticed very easily with general anxiety disorder. Also, when you're thinking about the left or right hemisphere, the frontal cortex, or the frontal lobe, the left lobe is responsible for like breaking down in the imagery. And this is shown with general anxiety disorder to be more active on the left lobe when they're seeing these images that bring about the worry. And this is an example where, like, if you had an issue with Auburn, Alabama, well, if you're an Alabama fan and you saw this, then you might have it might raise your worry a little bit. and that's showing that through the biological theory of the causes. The next theory would be the cognitive behavioral. The cognitive behavioral is showing that they are hyper vigilant to the threat. They want to just get away from the thing that's causing the worry or the stress. They can't cope with it, and so they just get away from it. Well, this leads to a negative reinforcement. This negative reinforcement is through, well, you feel the issue of the worry, so you get away from it, and you feel relieved. So you feel like you've accomplished success, and you continue to do this, and you end up doing no good for yourself, but making it worse. So now let's talk about the general anxiety disorder treatments. For the biological treatments, they say to use benzodiazepines most often. This is good for a short term. The book also describes that there aren't a lot of studies that show the significance of the use beyond 8 weeks. So again, it kind of shows that this is good for short term. It also goes on to describe with benzodiazepines, there are drawbacks. There's a physical dependency, a psychological dependency that's developed with these. There's also with the elderly causing issues with falling and loss of control, especially with the younger adults too. But then if you have an issue, they say that you want to try to generally prescribe it within 1 to 2 weeks. And this helps with dealing with like temporary crises. And this is with like family issues or something that's a short bout that you can kind of take these to kind of get you through that. Another medication that is shown in the book is Zoloft. It's an antidepressant, and it's shown to be very beneficial as well with dealing with generalized anxiety disorder. Especially, it said about 70% with the children in a study that was done with using Zoloft. So to move on to the psychological treatment, is that it is more focused on trying to use acceptance rather than avoidance. And this is good with the cognitive behavioral treatment, because in a cognitive behavioral treatment they are trying to elicit or evoke those worry feelings and bring them about to show them how to deal with it. And like the example earlier, when the War Eagle came on the screen, if you're an Alabama fan, that might cause you to worry. And so you need to deal with it. You don't need to just avoid it. So that's what the cognitive behavioral treatment helps with. Also, relaxation techniques are a method of treatment. This helps with trying to ease that muscle tension that was described earlier as well. Another form of treatment is meditation. Meditation is to help you become more tolerant of those emotions or those feelings that lead to the general anxiety disorder. Well, thank you for letting me talk to you, and I hope you enjoyed it.